Hey Mo,
Hey, Ricky.
the doctor is in.
Yes, yes, we are. Another amazing wellness woosah, whatever you want to call it, Wednesday. It's hump day.
It's hump day. It's Wednesday. It's been
Yes, it is.
raining here forever. It's like another rainy Wednesday, but it's all good. The angels are making the flowers.
Yeah, it's been pretty miserable.
Yeah,
Yep,
yeah.
you
But
got
we're all
that
here,
right.
and we are going to talk about fertility today. And I don't think we've ever really talked about fertility in our 4 years. I
Mm-hmm.
don't know. It seems like a new topic for us, and but we called in our experts, and we've got two magnificently beautiful blesties today. We have Rhonda, who leads this incredible support group called Tata Tuesdays,
Mm-hmm.
and our precious Dr. Alexia
Hey,
Gaffney. So
I
they're here to
love it.
talk about
Welcome,
it
welcome. Yep.
and kind of, let's talk about fertility. And it's with so many young Black women getting breast cancer, it's like it's a topic. It's a hot topic because um, we don't know why they're getting breast cancer so young, but
Mhm.
clearly they're dealing with issues that I never thought about when I got it in my 50s. But it's really an important thing to think like, not only am I sick and I have this cancer in my boobs, but can I have children? I haven't even thought about having children.
Right,
I haven't even thought about getting married yet. I haven't even thought about any of this. And now it's like in my face. Oh, well, guess what? If you want to have children, if you want to think about it, you got to decide today. You got 3 days to figure it out. And that's
Right.
right.
a crazy, crazy place to be. So let's talk about it. And
Yep.
these
And we
lovely,
want to give
lovely,
you medicine to suppress your ovaries, right? We want to put you
right,
in the menopause,
right.
right? And when
What's
you
menopause?
just
When you're
got out of
25.
school,
Oof.
exactly. Well, let's tell your stories first and tell your
Yeah,
why and give
yeah.
people who might be joining for the first time. Let's do that and then we're going to talk about the ovaries and what they do and then suppression. Yes.
Oh, yeah.
Great, 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 great,
All right. I'll start. So
great.
I'm Dr. Alexia. I am a 6-year breast cancer survivor thriver.
Woo!
I was diagnosed with stage 3 breast cancer and found to have a PALB2 gene mutation and an ATM gene variant in 2018 at the age of 37. I had all the things: mastectomy, chemo, radiation therapy. And because of my age, I was put on a 10-year hormone suppression plan, right? So 10 years of medication induced menopause, right? Or
So
ovarian
use the
suppression.
word, define the word suppression for people.
So
What does that
suppress
mean?
for yeah. So when we talk about suppression in the human body, we're talking about like shutting down the function of an organ. So the primary reason I'm on the ovarian suppression is because my breast cancer was estrogen and progesterone receptor positive, right? So those hormones that the ovary naturally makes as part of our reproductive health, and estrogen does so many wonderful things in a woman's body. It doesn't only feed cancer cells; it does amazing things for us. Um, but it was feeding my cancer cells. So in order to help keep my cancer at bay, decrease my risk for recurrence, distant metastasis, they put me in ovarian suppression. So every month I get a shot in my belly that stops the signal from my brain, that my brain tells my ovary, hey, make some estrogen, right? Do that thing you do, ovulate, prepare to make a baby, to avoid those surges of estrogen. And then in addition to that, I take another pill to stop like my fat cells from making estrogen so that we're not feeding my cancer. But as I mentioned, right, estrogen does so many good things for our body, right? And it plays a vital role in our reproduction. So shutting down our ovaries as much as it is keeping away my cancer, it has taken away my fertility. And even before I got to that leg of my treatment, obviously well, I shouldn't say obviously, my oncologist warned me that it was a possibility that my chemo could cause premature ovarian failure and leave me infertile or sterile or whatever words you use for it. And I was given the opportunity to do egg like fertility preservation, and I didn't take it, and I regret that. I regret that. And so, when we are having these conversations, I want to share my story and that perspective and give people food for thought, because you don't know how you're going to feel on the other side of cancer.
Mm. Wow.
You don't know. And some of us don't even have another side, right?
Right.
But you had your daughter already.
Yes. Yeah.
Well, how old was she when you got cancer? She was a baby child.
Yeah. Kennedy was 6 when I got cancer.
Mhm.
And it was interesting because, she had always inquired about having a brother or a sister. Why am I only child? And it, like, that conversation got real loud and real present when I was going through cancer treatment, because, she'd want to play ball or catch or badminton shortly after my surgery, and I couldn't do those things. So I would like sit in the chair on the lawn and like toss the frisbee or toss the birdie or toss the ball. And she'd be like, well, why can't you get up and play with me? And then, I just had surgery. I'm in pain. I'm not supposed to do that. Well, why don't I have a brother or a sibling? I'm the only kid who doesn't have a sibling. Why didn't you give me a sibling? And it was just like, whoa.
Wow.
So it
Wow.
definitely is a part of our lives. And even for women who maybe have not yet had children or do have children, like, we're always being asked, like, are you going to have a kid? Are you going to have another
Right.
one?
Right.
And it already
Especially when you
stings.
have an only child, people always
Yeah. It
Yeah.
already stings to be asked, but then it's like, do I really want to get into this conversation? Do I want to start verbally sparring with people and telling my story and all of that stuff? So, I'd rather just use that pain and energy to just, enlighten the women who may find themselves at risk for genetic reasons, family history, just got diagnosed and aren't knowing what to do, to just hear it from someone they relate to.
I hate that it comes to that though, because I
Yeah.
feel like that's the reason why when we say, oh, why do people keep it to themselves? It's because folks don't know what to say out of their mouths sometimes, out of their faces,
Mhm.
right? They say
Right,
really
right.
inappropriate things that make you not want to disclose. And we don't talk about that very much, Ricky, as we talk about telling our story to everybody. But those words, they hurt. And when you're already
Yeah.
going through something and you're already feeling some type of way, all the feels, right? The guilt and worry and shame and fear and everything else, you
Yeah.
don't want to hear that stuff. But I love how you
Right.
turned it into purpose, and really focus on helping people who need to hear that messaging, as opposed to talking to the folks who don't.
Yeah, you
Yeah.
already feel inadequate as a woman, right?
Right.
And now, right? Like, I have no boobs. Is that a sex object or whatever, right? And then you have
Mhm.
a whole thing to it. Like, it's almost like you start to question your purpose, which is a horrible place to be. Horrible
Yeah.
place to be as a woman, right?
Yeah.
Especially when you're 25. I mean, you were like in your 30s, for God's
Yeah.
sake, and
Yeah.
but we have these babies getting sick.
I
Yeah.
know. It's just, 18,
Breaks my heart.
21,
Yeah.
25, 27, just thinking of the young women that I know in the community, thinking of their ages when they got diagnosed. The first young woman ever met with breast cancer, I met her at 25. She was 16 when she got sick, 21 when she got diagnosed, and I was meeting her at 25 when she was metastatic. It's like your peak, reproductive years. She was going through this.
Wow. 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 Whew. Okay, Miss Rhonda.
Can you hear me? Because I can't tell if I'm on mute or not. Hello.
We
We
got
hear
you.
you.
We got you. We hear you. We got you. Loud and clear, girl.
I'm moving things. I can't tell. My name is Rhonda. I am the lead her of Tata Tuesdays. I was diagnosed with breast cancer at 40. It was my first mammogram. I found it myself. Up until that point, I hadn't really thought about kids. I had 2 miscarriages in 05 and 06. And after that, I was just kind of mentally, I guess, blocking out the idea of them. It was more like, if I can have them, my whole thing in life is I want whatever the Lord wants for me. So if it was for me, then I was going to chase it. If it was something extra I had to do, maybe not so much. So I was comfortable with the rich auntie vibes until they told me that I couldn't do it. Now that's different. When someone is taking
Yeah.
something from you.
Yeah.
One of the things that I love specifically about these type of conversations is the education and the vocabulary words that come out of it, because I did not know what the lady was talking about when she was talking to me. So when the doctor was going through all of the side effects, and she rambles off something about infertility and what do you want to do with your eggs, but then moves on to the side effects of chemo. And I'm like, well, wait, it was just so much information coming.
Like, whoa, right.
At one time, I was like, well, yeah, I'm still young, kids, we'll talk about that later, not fully understanding the ramifications of chemo. Or also, like, tomorrow I have my Zoladex shot. Like, I'm always going to be in this menopausal position where isn't safe. And then after coming out of chemo, then she wanted to have the conversation again. Like, did you ever see the fertility person? Do you want to see them? Because we're going to go into these next stages, and I don't want you to get pregnant for at least 3 years. So now I'm thinking, man, I'm going to be a dinosaur when I have this baby. I don't know that for me. I mean, I don't know if I want to be 45 chasing around a kid. I don't know. That really it wasn't my initial focus. And I really commend all of the women that make it theirs, that make it their passion to figure out ways around it. They want to be moms, in a desperate way, that they fight for it. But with me, it just wasn't like that. Right now, I'm just trying to deal with all of the side effects of menopause. I have osteopenia now. I never had no bone problems. You know what I'm saying? It's the side effect of the chemo and of the estrogen suppression. And then just sticking with the regimen in fear that I would have to go through breast cancer again. I have some breast friends that have taken themselves off of the medication and celebrated when their periods came on because they so desperately want to have kids. And I am scared to death, and I won't share that with them because it's not my place. But it's a difficult position to be in as a woman. I don't know. I mean, we all have different desires. We all grew up on Disney. We all expect the prince and the knight and the horse and the babies. And somewhere along the way, you realize that shit might not be real. You know what I mean? So you approach it from
none of it. False bill of goods, all of it.
Yeah.
That's why you got to make your own happy ending every day.
Absolutely. And that's what I know, that I was placed here to have adult children. And at this point, I have about 200 of them. It's cool.
Love it.
That's my role. I don't think that everyone's supposed to be, rich. Everyone's not supposed to be poor. Everyone has their place, and this is mine. So I'm at peace with it. I'm so sorry I didn't fully understand what she was saying, just to give myself the opportunity. I'm a self-employed person. I had been self-employed since 2008. A part of my story is I didn't have health insurance. So in the beginning part of all my breast cancer stuff, I paid for it out of pocket. Wow. And I say that because I didn't have health insurance. I'm not attached to a large company. My ability to freeze eggs would come 100% out of my pocket. My insurance company, when I asked them to send me to a fertility specialist, they transferred me to a nursing home. So I was like, okay, it's not anything that you offer. Okay, I understand. But it wasn't, wow. Everyone's insurance doesn't cover it. And when they don't, and it becomes like what could be financially exhausting, even more so, because fighting cancer is expensive. Even if it's not you physically paying medical bills, I know I didn't really feel like working. So I floated a lot throughout the process. I just couldn't add anything else financial to my stuff.
Yeah. Yeah. Wow. I had a conversation once with another org, I can't remember which one, and we were talking about like getting creative about paying for cancer treatments. And what that was for me was to not finalize my divorce. I was in the middle of a divorce when I got diagnosed, and I called my attorney. I'm like, hey, can we add to these terms that I can stay on his insurance? And she's like, no, his insurance is great, but once that divorce is finalized, you just can't stay on it because it's provided by his employer. So I just stayed married on paper. Like, so,
gotta do what you gotta do, right?
You gotta do what you gotta do. And, grateful that he was agreeable to that. So my mind is like completely boggled each time I hear you say that you paid for your cancer treatment out of pocket. Cause I was just like, I'm not about to let this bankrupt me. I'm not spending extra money I don't have to spend, because when it came to the conversation about preservation of fertility, one of the things was, well, I'm in a relationship and I love this person more than I love the idea of having an imaginary baby. And, it costs, tens of thousands, hundreds of thousands to retrieve and freeze eggs and
Right.
implant them and get a surrogate. And I'm not doing all of that. But
All
like
the
I
things.
processed all that in 3 minutes in an exam room with my doctor staring at me, gonna make
That's all.
decisions.
That's literally all. So even in when I do my intake of breast friends, I've added, do you want kids? Because we need to make sure that you understand what I can't be in the room with everybody. Most of the women come to me and say, Rhonda, what does this mean? Or they'll send me their whole mind chart.
Right.
Break it down. But I asked them in the beginning, do you want kids? Because if so, we need to circle back to your doctor. We have to introduce it early.
Tell me more about these breast friends you're talking about. Is this something that you do? Is this consulting? Is it? I love it.
Okay, so
Have
all
your time.
of my girls are hers. You are a survive her, a worry her, a caregive her, a grieve her, or a support her. You have all types. Even if you have never had breast cancer, you can still attach yourself to our organization, because really what I want to do is always be a number one, a safe place, but also a first stop, because I can't believe how many people I can call by name whose phone numbers are already in my phone that have been diagnosed with breast cancer in my community in like the last year. Back in the day, it would be one person every 7 years that you heard had breast cancer. Now I have literal people's numbers I can dial that have it. So I need them to know that I'm here for them. But everyone, all of them are considered my breast friends. The purpose of my organization is to place you with your breast friend that's one step ahead of you in the journey, so that they can help guide you to where you need to be. So if you're about to start AT, this person just did it. They're still in it. They're going to hold your hand. I'll be here on the other side. You're doing a double mastectomy. This person just did it. This person's doing a D-flat. This person just did it. We can always keep you so that you have a better expectation of how it should go. Also, you'll know how to advocate for yourself. A lot of doctors, specifically in Maryland, are telling women, oh no, you can just do a lumpectomy, but they're not listening that she wants a mastectomy. So just knowing when you listen to other women's stories that, well, I said I want this and they gave it to me, it lets you know that if you say you want it, they can listen to you and give it to you too. We go into the situation completely ignorant. That's why I'm always so in awe when I speak to you all, because y'all know so much. We don't know nothing.
We don't know. And the things that we don't know are scary. But I mean, you said it, you both said it earlier, that you wish you had had more time or more information or more, just more of a connection to understand what you were getting into. But the doctor didn't spend enough time with you to explain it properly, to explain it thoroughly, or even give you time to digest it and manage your thoughts around it. So, and you guys probably knew more than most, right? You're a doctor, so think about someone who's 25.
Yeah.
We have like 3 breasties right now, 25 dealing with stuff, right? They don't know anything about this. And so when they're put in that situation where they got 3 minutes to make a decision about something they haven't even thought about without being sick.
Right. For the rest of their lives, their whole future, right?
Their whole future lies on this. Like,
I don't know that we can put an age on it though. At 40.
Yeah, you're right. You are right.
The whole situation is so overwhelming. My family, everyone always had a doctor buddy. And I was like, why do they need them to go to the doctor? Because you don't listen. Like as soon as they start talking, check out, because it's overwhelming. You can't. That's all of that.
Yeah. You hear the absolute worst case scenario, you hear the absolute best case scenario, and you don't hear anything in between, which is, most of the time going to be the reality of the situation. And as a physician, I had 3 people with me at my first oncology appointment and at my breast surgeon, plastic surgeon appointment, and a sister with me at every visit writing notes. And to this day, I have those notes. And I always say, what do the people who aren't in healthcare do? What do the people who don't have a neighbor, mother, father, sister, cousin, friend who is a healthcare professional to advocate for them or help them advocate for themselves? What do these people do?
They struggle. And it's tough though, because I talk to the families, and I say, listen, all she heard was, and I talk about cancer in terms of like food. So I'll say, the dough popped out of the can, like a can of crescent rolls, and that's invasive breast cancer. And I say, all she heard was want biscuits and cancer. She didn't get it. So this is for you. what did you hear me say? So when you
Yeah.
get home,
You
says,
can-
what did that
right.
doctor say? Because
Right.
all I heard was cancer, and then I heard the word chemo and I blanked out. Somebody has to be able to do that. And you're right, people who don't
Right.
have advocates with them, it makes it so hard. I
Yeah.
feel like though, and Ryan, I'm gonna get back to your point in a second. Like I feel like telehealth is where we could help with some of these conversations
For
because it's
sure.
hard to go over everything in one visit. I spend
But-
an hour with the patient and I still barely get to all the genetic testing and then get to fertility because you're just trying to wrap your mind around everything
Right,
else.
right.
And to expect people to make that decision right there when they've never even contemplated a life with
I
cancer or
know.
surgery
Yeah.
or anything, it's a lot to ask.
Yeah, it really is. I mean, as a physician, as much as I have to say about the gaps in my care and, where things did not work out for me, I do also find myself in defense of providers a lot as well, because we're not the experts in every single thing. And, the provider has one agenda, the patient has another agenda, and they got to meet in the middle in the span of, however many minutes your doctor may carve out, insist on, or if they're in a health system that is, somebody's knocking on the door in 10 minutes, that you got to get done what you got to get done. But I agree, Mo, like there needs to be, a follow-up visit with a nurse navigator or somebody who can just take the time and break it down. Maybe
Break it
it's
down and walk through it.
a 15 or 30-minute telehealth every day for the next week after your initial visit to just go over one thing at a time. Like maybe that's something we need to be advocating for
Right,
because
right.
we've all, we're sitting on both sides of it
Right.
between this collective right here.
I
Well,
think that
Go ahead.
I'm sorry.
Go ahead.
I- going to say to what you had said about people bringing advocates, we also have to consider the women that don't share that they're in the fight at all. Like
Right.
they go alone by choice. They don't want to,
Mhm.
they definitely don't hear. But to your second point, I'm having a chemo brain moment. To your second point, when my doctor spoke to me about it in the room, and then my nurse navigator did call me back. The only thing I remember about that, it was my my doctor's PA. When we were going through the everything about the effects of chemo, the only thing I walked away from in that conversation was that chemo could cause cancer. So she went through all of that other stuff, but it was like the major stuff that she was saying that was sticking out to me. I think your idea of going through it day by day, way better. Give me
Yeah.
I agree.
Right. Yeah. Syllabus. I love that.
Yeah. Well, also though, when you think about it, you're in the room with the oncologist, right?
Mhm.
So the oncologist's job is to cure the cancer, get rid of the
Kill the
cancer.
cancer.
So
Yep.
right, so in their set of priorities, and Mo, you could speak to this better than anyone, in their scheme of what the priorities they have to cope with in this next hour or 40 minutes or 10 minutes, whatever they have with this patient, they're going to focus on the cancer and the chemo
Yep.
and the treatment and the radiation or the surgery or whatever. They're not even going to get to fertility. So in the ranking of all the things they're dealing with, where does fertility even play in that list?
Yeah.
It's lower, but what we started to do, cancer programs now have some guidelines for like our program accreditation. You know how you hear like Center of Excellence or these like NAPBC accredited breast centers, things
Mhm.
like there are checklists of things conversations that we have to have with patients. And at some point we go through that list and we say, okay, did we offer plastic surgery? Did we offer a clinical trial? Did we offer fertility? And so all these things have to be like checked off, even survivorship and assessing their performance and activities, food insecurity now. So we're getting better at it in terms of standardizing the questions we're supposed to ask. But it usually ends up a pamphlet in a bag or a binder, and then call us if you have any questions about it because we ran out of time. So you're right, all this stuff doesn't get done. But somebody said a curriculum, and I just love that. The educator in me was like, curriculum. That sounds like something
let's
we
write
should
it like
right?
this,
Can
make
you
the
imagine
binder.
a 7 days, 7-day program to understanding your breast cancer diagnosis, right? Day
Right.
6, fertility.
I love
Me
that.
too.
Because it's all foreign language. I tell people, be like, you know so much. I'm a sponge. I've spent my whole life being a sponge and absorbing information and trying to give it back to people. But most people don't have that talent. That's not their skill set.
No,
So
no.
we have,
Especially when you're sick and scared.
Yeah.
you
And
know,
Morgan said in the chat here, she
everything's
said,
up.
how about we promote fertility knowledge in women without cancer?
Right.
Right? Like how much
Right.
did we know about fertility? But she said cancer adds an entirely new level. Morgan, you're absolutely right.
You're right, Morgan. Yep, yep. I saw,
Yeah.
yeah. I know. So a few minutes ago, you talked about your Zoladex shot. What's that?
Mhm.
Zoladex is a shot that helps me, my ovaries. What did they say? It tells my brain for my ovaries not to produce estrogen. That's basically it. Zoladex, they say minimum until I decide to have an oophorectomy, which removes my ovaries. I don't really want to have any more surgeries right now, so I just keep going for my shot. I'm over surgeries. And then even
Mhm.
doing it because I
Oh,
don't.
does that tell your ovaries not to make eggs or two, or like what is the whole process? Like what does it do for you?
Dr. Alexia, help me. I do not
Yeah.
know.
So yeah, it shuts off the ovaries altogether. Because if the egg is not going through the normal cycle of produce the hormone, produce the egg or the follicle, release it, hope it gets fertilized. If not, the hormone level goes down, and then we have a period, and then the whole cycle starts all over again, right? So it basically is shutting the egg down. Shutting the ovary down. So no eggs are produced, no estrogen is produced, and in that way we end up in menopause or chemopause, right?
Right.
We think of Zoladex almost like a chemotherapy, just, it's not making your hair fall out and it's not killing cells, but it is preventing the cancer cells from going by cutting off its life source. So,
It also affects the brain. So the hormones that
mhm,
that stimulate your ovaries to do stuff come
yeah,
from the brain, from the pituitary.
yeah,
And so it shuts off that signal to even get to the ovaries
yeah,
as well. So it definitely is it's a doozy, but it works on your whole body, works on your brain and everything. And so you got to wonder the impact of these things, on your whole body, not just your estrogen and not
yeah,
just your ovaries, but when people talk about things like chemo brain, and you talked about osteopenia, right? Like
yeah,
estrogen does a lot of things in the body. And while it's
mhm,
true, if we were meant to have estrogen forever, we'd have a period forever, but still blocking it in a young age can cause, some cardiac stuff, the bone
yeah,
density, the hair
Right.
loss, it can cause hormonal disruptions. So it's not an easy decision. And doctors are like, well, they do a test and they say, well, you're high risk for recurrence. You should go on this pill, but we should also give you this shot because this is going to reduce the chances of your cancer coming back. It makes the estrogen blocker work better. And then you're supposed to like just go with that. And
Right.
they don't really talk to you about all the side effects of Zoladex. I feel like I don't hear my oncologist saying a whole lot about it.
Well,
yeah,
But it's
I
protecting you in the long run from your cancer coming back. I mean, so it's like a, balance. What do you want? Do you want to just obliterate any chance of recurrence? Right? Do you want to make sure that, or do everything you can to make sure the cancer isn't going to come back? Or do you want to maybe take a little risk and have a baby? Oh my
yeah,
God. It's like Sophie's Choice,
yeah. Well, at least now there's data
right?
on that, because there was no data when I was treated. And so when I got treated and started on the Zoladex, my oncologist said, like, if you're going to think about a future pregnancy, give me 2 or 3 years on the Zoladex and then come off and try if that's what you want to do. But she didn't have any strong data to base it on. She just was like, let's just, make sure. She said
Right.
her rationale was that the most likely chance of recurrence was in the first 2 years if it was going to be a relatively early recurrence. And so she was like, keep your port, which I snuck and got out, and do this Zoladex for 2 or 3 years. And then you can come off and see what happens. And we see a number of women in the community who are sharing their stories, who are achieving pregnancies, coming off the hormone suppression breaks or before they have their ovaries removed. But we know that that's not the norm, and that infertility is one of the common reasons that oncologists are sued or brought up for malpractice if they didn't warn a patient that they might end up with
Yeah.
infertility. So
Wow.
it's
Wow.
almost like
Interesting.
a toss up, but at least we know so far, early preliminary data that it can be done safely.
To Dr. Mo's point about the side effects, I did not realize the side effects of Zoladex until I came off of anastrozole, because I thought that everything was really stemming from that. My hot flashes and all, I thought they were coming from anastrozole. Now, they were made more severe by anastrozole. I'm now on letrozole. And I had extreme bone pain on anastrozole, but Zoladex 100% is a part of my hot flashes. So if I'm not taking anything orally and I just have this shot, I am hot all the time. So that's a Zoladex thing. My bone pain may not be as persistent, but it still is there. I'm also on Verzenio. Verzenio dry kidneys. So I was like, this is a poop show. I mean, every time you turn around, the good thing is that I do get blood work done every month. So I always know what my body is doing, but it's just amazing that I am going through this at this age, because I would expect to go through it at an older age.
Right. So many things, but I think the good news for that you can go off of it and have kids, but I mean, it's also then sort of the age plays into that, right? At 40, do you have kids? At 45, do you want to have kids? But for the 25-year-olds, it's a good thing, then they can make a decision not to, to be able to have kids, stay on it for a couple years, but it's so complicated.
Can I ask a question to Dr. Mo? Or Dr. Alexia, either one. If you're specific grade of cancer, like if you're grade 3 and you come off, decide to have a baby, or are you putting yourself at a higher level or risk of reoccurrence? Since the grade is, I'm a grade 3, so I know my cancer is aggressive. But since it is aggressive, if I was to come off, am I putting myself at higher risk of it reoccurring?
So the short answer is yes, probably. Not just because of the grade, right? Because the grade is one of the ways we can tell how fast the cancer is growing or how aggressive it is. And you did the treatments for it, right? Now, if you stop the treatment, the question is, how much of that treatment did you get? And would you necessarily go back on it? Now, pregnancy can cause a whole host of other hormonal things that puts you at high risk for breast cancer happening again. And so, and we see that when, young women who are pregnant, they get aggressive breast cancer sometimes. So the short answer is yes. But the longer answer is that we're discovering that, not everybody needs to be on that pill every day. We can do half dose. We can go every other day doses. And there's some good studies coming out that are looking at ways to do this to make the side effects more manageable. So it really becomes a very personal decision. And if you've done 3 years already, well, maybe that's pretty darn good. And you're optimizing your nutrition and your wellness and all the other things. So yes, probably.
Right. Probably. Yeah. Wow.
Yeah. So we didn't talk about the flip side of it, right? We're talking about the after. And we mentioned, preservation of fertility through egg freezing, like very quickly. We sort of glossed over that. But we didn't really talk about the fact that, you can be on ovarian suppression even during your chemo, like initiate that before the chemo and sort of put the ovary itself into like a resting or a dormant state. To sort of protect it from the effects of chemo. And that can be done with Zoladex, and it can be done with Lupron as well. So
talk about that a little bit. Talk about that.
Yeah. So the same way that we're using it in a different way, right? So after chemo, we're using the Zoladex to shut down the ovary because we don't want the estrogen. But before the chemo and during the chemo, if you shut down the egg, you can protect the egg from the harmful effects of the chemo, because chemo works by affecting the rapidly dividing cells, right? So we don't want the ovary awake and doing its thing and being in the path of the effects of the chemo. So you shut it down, put it in a dormant state, and you're sort of protecting it from the chemo so that on the other side of treatment, you may have preserved the fertility in that way. And so that's also an option for young women as well. So that was something that, sort of caught me off guard because I wasn't really offered that. And, you know, just like we all talk about in the community, right? It seems like you could have a similar cancer or the same cancer, and people can be on different treatments. And yes, there can be different protocols, and maybe someone can't take one medication for some reason or another, or God forbid, medication shortages. But the offer of Lupron or Zoladex during treatment, it doesn't seem like that has been standardized as part of the care for younger patients, especially to help
Yeah,
preserve fertility. And so I'm like, the whole, let's not skip over this in case somebody needs to go in there and ask about it before their chemo. Maybe they're, you know, listening because they're researching as they recover from surgery before they go into chemo, and they're checking their options, and they're waiting to hear and see if somebody brings it up. If it's not brought up, ask about that. And if it's, you know,
right,
if you're told no, figure out why you're being told
right,
no. Is it a
right.
cost? Do they not want to fight the insurance? You know, is it an extra step somebody doesn't want to take? Like, what is it? Because I was um surprised that I had not been offered that, since I declined to freeze eggs as a way to preserve my fertility. And I just didn't know of it until I heard other women in the community talking about it.
So do you think it's because of how we answer the question? Like if the doctor says, are you trying to have a baby within this time? If I say no, would they automatically go to their next step? I mean, because
Right.
then like they wouldn't offer it if that's not the conversation that I'm leading.
Yeah, yeah, could be. And, you know, maybe that means that instead of just saying the blanketed no, we need to say, like, well, discuss with me all my options.
Right.
What are my
Right. Put them
options?
out
What
there.
it
At least give me a
like?
choice. At least
Right. I
give me
might
tell me
want
what the
to.
choices are. Yeah.
But
Right.
this is also an evolving science. So the articles from like 2018 are figuring out this, predicting the recovery, ovarian recovery, like how much is the ovary going to recover. So back in 2018, we were still trying to figure out how much the
Right.
ovary would recover. I'm looking at an article now, and I did put it in the chat in Facebook, that's now talking about, you know, really comparing the Lupron versus the Zoladex for protecting the ovaries, ovarian protection. And so it isn't a topic that most doctors know much about. And my counseling, I'll be honest with you, with patients, is like, okay, you know what? It's a great time to be intimate. It's a really bad time to get pregnant, because pregnancy changes everything for your treatment, your surgery, the chemos, the pills we can
Right.
use. So I basically counsel not to get pregnant. And I say, you know, where are we with your fertility goals? And that's it. So I don't even talk to patients, and it's more for the medical oncologist to do. But all the conversations are about young women, prevent recurrence, suppress the ovaries, not protect
Right.
the ovaries, protect the ovaries,
Right.
protect the ovaries. And
Yeah.
that's going to have to change, and that's going to have to come from the advocacy groups and from the young survivors and from folks like y'all, really, you know, say, hey, listen, we don't just want to suppress our ovaries, we want to protect them, and we want to be able to have options, because, you know, we're going to live long lives. And if we want to have children
Right.
and have fertility options, we deserve that.
Yeah. And
Right.
that's true. Like,
Yeah.
even just listening to you say it, I'm like, yeah, we're always ready to like tear our doctors up, but the age is shifting.
Yeah.
This was not previously a disease of women of childbearing ages. And
Right.
so, in all fairness, it wasn't a
Right.
conversation they were
Wasn't a
having
conversation. It
20
was
years ago.
But we got to stay
Um,
current. It's up to us too, though, Doc, you know,
yeah,
because
for
we can
sure.
say
I'm not
that,
letting
but, you
nobody off
know,
the hook. That's
yeah.
right. Right.
Right.
Got to think about it. At least give people the choices. But then, you know, also like you're 25, you get diagnosed with stage 3, and you start thinking about, first of all, can I have a baby? Am I going to be alive to take care of the baby? I mean, so
Yeah.
all these fears are brewing in your head. Am I going to recover from this cancer?
Can I afford children?
Can I
Family
afford
planning.
children? How long am I going to be sick? And you don't really know. I mean, it's so funny how I remember thinking, well, so how long am I going to be on chemo? Like, when does this stuff end? And
Mhm.
never really said, you know, you're going to be on it for 2 years. Hello. No one really knew.
Yeah.
I mean, I think there's so many questions swirling in your head
Yeah.
when you're faced with this issue that's so important and life-changing. It's really, really hard. So
Yeah.
we do. I mean, I think that, you know, we love our friends at, you know, just they're the company that makes Solodex. They, you know, they really want to make sure that everybody has the ability to make the choices that you can make in this situation.
Yeah.
And so are there things we could be doing differently? Could they be coaching differently? Or like, you know what I mean?
Yeah.
Or how do we explain it to patients in a way that's going to help them digest it and understand it and you know, make it, make it easier if that's even possible, because it's such a hard choice.
Yeah. Yeah, it's hard. One of the things that I don't take for granted is I can be at my cancer center in 2 to 5 minutes to go get my Zoladex injection, right? But then I know of women who are traveling 40 minutes, an hour,
Hours.
2 hours, 3 hours to their cancer centers. And so sometimes people aren't on the med because the ease of getting it once a month is really challenging.
Right.
But you can get the med and take it to a doctor's office locally and have it injected in that way. And as I'm coming up on 5 years on Zoladex, because this is my 6th year post chemo, my oncologist was like, listen, there's a possibility that your insurance won't pay for the drug. And then she said, well, I'll petition the company and see if we can get it through compassionate use. If you can't get it paid for, she said, you might be able to get it paid for, but you might have to take it home and inject it yourself, or,
Wow.
get somebody in your office to
Right.
inject it. Or, if you get it through the company, if you can't get it from insurance coverage without the injection, you might get it through the company for compassionate use. And I was really impressed that that's something that
Yeah,
they
to give
do,
it
like
options.
their level of commitment to keeping people who qualify protected. And, the idea of sticking that needle in myself seems kind of daunting, but I would do it once a month, just like I show up at that cancer center once a month,
Right.
because I know it's for my long-term health and well-being, and I'm grateful to have a plan, right? We think about triple negative where there's not that additional treatment option.
We don't
Uh,
have it. We don't have that.
yeah,
We don't have
yeah,
that, we have
yeah.
nothing.
So it's
Yeah.
all perspective. And so I'm grateful to people who just keep saying, like, what can we do better? What can we do better? What can we do better? What else can we offer patients? And so even like during the pandemic, when cancer centers were closing and all of that, I got a 3-month shot. Like, it wasn't, per protocol. Protocol is monthly. That's the way it was studied. But at least I had an option that kept me in care until all of the chaos of we don't
Mm.
know what the heck's going on and everything's shutting down, including our cancer centers. Having that every 3 months injection was an option. So
Right.
there's just like, the flex, like, not that the treatment is flexible. I don't want to make it sound like, oh, you can pick and choose the way you have it done. But in that time frame when I needed it, I had that flexibility. And just to put it out there, maybe you want to go to another country and lay on the beach for 3 months. I don't know, but at least you won't be off of treatment or have no coverage or no protection.
So let's talk about the process. It's like the reality. And Rhonda, help me out with this because you're dealing with patients every day. So you get diagnosed with breast cancer, you're 25, 30, whatever. And the doctor, you find out probably from a friend or one of hers people in your group that you're a best friends. And they say, oh, did you guys hear about preserving your eggs or Zoladex or whatever? So how much time do you really have to make this decision? And if you do decide to harvest your eggs and do the fertility treatment or whatever before you do your chemo, is that even feasible? How much time do you really have? Do you have to be rushed into this decision that we need to know in 3 days or we need to know by tomorrow? Like what's the reality of like, and probably depends on the severity of your cancer, I'm guessing, right? But like, how much time can you even have to think about this if you had that luxury?
All of my breast friends are rushed. I know I was rushed, and I was not. Started at 0 and ended up at a stage 3. I wasn't supposed to have any chemo, as far as I know. So when everything in the breast cancer process, as most of you know, it goes really fast. Like, everything is just happening at lightning speed,
Right.
which the best interest of your health is just not in your sanity. You don't know what's on. And a few minutes ago, someone said, well, what can we do? make videos. You know, on my Breast Friends Unite page, I plan on having videos of different vocabulary words so that when women hear them, they at least know and have a point of reference of what.
Yeah.
So even if you write it down, come back. I don't, the fertility part of it, like I said, it moved so fast. It was such a small part of the conversation, even though it's life-changing. It was small in relation to how big my cancer was. And
right.
You don't fall inning because you want to get healed. You don't want to be in this position. So pretty much whatever they say, that's what you go with. It's just whether or not those things are right. You don't know unless you have courses like this.
Right.
And,
I mean,
and
I
to
just
your
wanted the cancer out of my body as fast as possible. Like get it
out of here.
out of me, right?
Yep.
And to your point though, Rhonda, you know, the further along it is, the faster we move, right? And so when the doctor's like, no, we need to go now, it's not because they want to talk you into something or out of something. It's because they know what's happening and where it is and the potential for it to spread and to end up a different ball game. But in general, the recommendations are 30 to 60 days. You know, we like to initiate treatment from the time you're diagnosed to actually doing something. And surveys and the studies, actual peer-reviewed studies show that Black women have longer delays from diagnosis to treatment. And some of it is bias and some of it is, you know, the system issues and maybe underinsured and you got to get insured and we got to get this and get, you know, all the things. Some of it is our own choice in delaying because we want to talk to our minister. We want to think about things. We want that time, but that time can be costly too. So you really have to balance. And you asked the really important question, Ricky, that should be on everybody's list of questions to ask the doctor, which is how much time do I have to make decisions? Right? How much time do I have realistically?
Yeah.
When more than 3 minutes, but not 3 months. You know?
I know. Yeah, but I you know, even now, like to me, I had, you know, back in the old days when I had cancer 12 years ago, we did surgery first. And now, you know, with all the neoadjuvant stuff and Keytruda and all the drugs to like shrink the tumor, I don't know. That sounds scary to me because it's still in my body. I just wanted it out, even though we have more efficacy with that.
I had surgery first, but that's because I was doing my own thing, paying people. But I had surgery first, and when I hear women that like, for example, I had a girl call me the other day. She was disgusted with me by the time we were done, but that's okay. She was diagnosed with breast cancer in 2019. Went into the hospital, never went back. Now she's metastatic.
You can't even imagine how many stories we hear that.
So she says to me, I'm not gonna do no chemo. I said, okay, you can go die. Like, how do you envision this going? Do you think it's going to be fast? Because it's not. You are going to experience every organ in your body shut down. Is that what you want? Like, is that how you see yourself? I think to Dr. Mo's point, I believe you when you say the faster your cancer is growing, the faster we move. In our community, it is difficult for them to trust you as a doctor. It's so much misinformation. I watch women go grieve about their breast cancer on social media, and you'll see the comments like, "You don't listen to your doctors. Do what the doctors do it this." And I'm like, "Yo, they've never had breast cancer before.
Right?
Them. Where's the data? Don't be the data."
Right.
He said, "Well, chemo only works 3% of the time." I said, "Well, that can't be right. I got 100% mortal rate in my group. That's not true."
That's not true.
So it's really a trust factor, I think, that plays into how fast we move. In my case, I was delayed by my doctors and scheduling. I was diagnosed in November. I didn't have surgery until March. But with her case, I mean, like she totally knew for the last 4 or 5 years that she had breast cancer and was going to
didn't do anything.
Yeah. It's a shame. I see it a lot, but and educated folks too. So much misinformation, so many myths, and it's so easy for us to believe a little bit of truth smattered in with the things that we've seen. And you know, they didn't get sick till they went to that hospital, or you know what, they were doing okay until they did that chemo. And the reality is they waited so long that their body wasn't in any good condition for chemo, and so of course it accelerated things because the cancer had already ravaged the body. But you're absolutely right, is that, you know, when you don't know who to trust, And doctors don't meet people where they are either. We never
No.
say, listen, I understand, I know you understand food is medicine. Let's talk about how that can work together.
Right.
Right? We never, you don't hear that enough. And so there's
Yeah.
nobody building that trust, unfortunately.
Mhm.
Yeah,
Right.
and that's the importance of these platforms and us sharing our stories and,
Right.
you know,
Getting the
taking a
word out.
stand for
Yeah.
our community because, you know, I'm constantly busting the myth that, you know, oh, you shouldn't have cancer surgery because when they open you up and the air hits the
Oh,
tumor and
yeah.
it's spread all over the place. And I'm like, no, 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 no. Like,
And the biopsy
y'all,
spreads the
That, I know.
cancer.
yeah, I'm
Don't
like,
Yeah.
believe
y'all,
it. Yeah.
that's not how that works.
Yeah.
And
We
so
had a
like
woman in our
something like
support
that.
group who, she had triple negative, but she was in her early 70s, but she had all these preconceived notions about chemo. And she had, stage 2B triple negative. It was no joke. And it took us a good month to convince her. And it was really her daughter and who just had a baby to convince her that this is not a choice that you have, honey. It's either what are you going to do or death, right?
Mhm.
And so it's so hard when we see women who just,
Yeah.
what I can think of is my grandmother's word, hard-headed.
Listen, I asked the girl from 2019, I said, do you do hair by chance? I mean, do you do nails? These are things that we go and we pay for. These are services that we cannot do.
Right. Every day.
A doctor. Like, are you a doctor? Are you doctoring yourself? Like, you don't know. So why would you depend on you with such lack of information to make decisions regarding your health when there are specialists that can help you, but they just don't, they don't want to hear it. They don't.
I don't want to
Yeah.
hear it, or they hear like, oh, I got neuropathy, I can't walk anymore. Like,
Because it sounds better. It sounds sexy to say, I'm gonna do a holistic. You don't even know what
Yeah.
holistic means. You wouldn't,
Yeah.
and the things that it really, really requires, once a cancer has formed and once a cancer has spread, like the body, we're already starting from behind.
Yeah.
How many strawberries does it take to cure breast cancer, right? The world may never know. And
Right.
and so it's wild, but I just think that we really gotta talk to our young sisters, especially because so many young women and they hear and they see the horrible things. People don't necessarily go online and say, I had a great experience with chemotherapy. Or you know what? Wasn't as bad as I thought. But 80% of my patients who do chemo say, you know what? It wasn't like what I thought it was going to be. It wasn't a walk in the park, but I wasn't sick every day. I was still able to do this and do that and whatever. And it's different for everybody,
It's different for everybody. It's different for everybody.
but
And
it's different for everybody. So it's
and-
not your mama's tumor, it's not your girlfriend's cancer, it's not your grandmother's chemo. It's your journey and it's going to be different and they can change the dose. They can modify the
right,
dosing.
dose. And you can also take different medications for side effects. I
Yeah.
mean, Zofran was my friend. I probably
Sea moss.
overdosed on Zofran, right? But I mean,
Right.
think about
Yeah.
you can figure out what works for you. But I mean, I think the one thing that I think we all can speak to is how you lose control. I
Yeah.
think
Yeah.
the one of the hardest parts is like, whose body is this and what is it doing?
Yeah.
You lose control. So when you can get information to give you control, like a drug like Zoladex, to say, yeah, you know what, I can make a decision about my fertility. I do have some control here over this part of my life or this part of my treatment, then that's a good place to be. And I think without the knowledge of it though,
Yeah.
Right. Yeah. Like we don't know how many women are declining chemo because, they don't want to
right,
lose their fertility.
they lose their fertility
And because they also don't know, they can take a shot to suppress
and
their
have it.
ovaries to
Right.
help protect that, so whenever I'm giving information, when people are like a hard no about a thing, whether it's a antibiotic or a PIC
Right.
line or a vaccine or whatever it is, or talking about chemotherapy or talking about staying on hormone suppression,
Right.
I ask people to just hear me out. Like I'm not making this decision for you. I'm not trying to strong arm you into doing what I would do. I just want you to make a decision based on the right information. And if you hear all of the accurate statistics and data and side effects and complementary therapies and what we can do to manage side effects, and you still choose to forego chemo or surgery or whatever it is, we can respect that. But really, it's not, because we're not shaming people who don't take chemo. I frankly
Right.
think it's a very brave decision. And it's a well thought out decision for many people, but it has to be based on the right information. And I think It's just important to make sure people have accurate information to
Yeah.
make the decision on, and to say, like, you can do complementary therapy and all the holistic things and still do chemo, and they can work together and collaborate with your doctor on that, you know?
Eat the,
Um,
eat the strawberries, but take the drugs.
yeah,
Right.
And you know, and the point of the whole neoadjuvant thing, because people say, well, get the cancer out. So I see women on the other side say, well, what am I treating? How do I know it's working?
yeah,
And when we give it up front,
Exactly. I didn't know it was working. I didn't know what
Yeah.
was going on in there,
Yeah.
right? So
right?
when you can see the progress of that, that's a great thing.
Yeah.
But that's what we're here for, hopefully, you know, and Lisa Ray, Sand Ray, thank you. Yes, educate, and educate our youth, you know, because you
Yeah.
know, also we're getting educated when we're in crisis.
Yeah.
Yeah.
You can't learn that way.
It's crisis management. So, you know, all these things, whether it's what a clinical trial is, what chemo is, what all these things are, you're learning all this with the, you know, with the hose in your face, right?
Yeah.
Yeah.
When you're in
Yeah.
crisis, when you're scared, when you're sick, when you're not feeling great. And so how do we educate before that? You know, how do we talk about these things? And you know, and especially that's one of the things that we're trying to talk about with Love of My Girls is let's talk
Yeah.
about fertility. So you're ready and poised for these things that, you know, that you got, and both of you guys felt like you were rushed. Both of you guys felt like you had a little bit of remorse after the fact saying, maybe I should have done that differently.
Yeah.
You know, so how can
Yeah.
we, young women or everybody say, you know what? You can ask for this.
Yeah.
And it always goes back to treat others how you want to be treated, which is what
Yeah.
was the
Yeah.
best, you know, like,
Yeah.
you know, how would these doctors treat their mama, their auntie, their daughter, and coach them regarding fertility in this conversation, right?
Yeah.
Yeah. You know, and I just tell people, nobody ever goes online and says, you know what, I'm taking that tamoxifen and I feel pretty good. You always hear the horror story. I've never
Yeah.
seen a review online, a good review,
Right,
but there's,
right,
you know,
right.
60% of my patients are rocking out and they might have an occasional hot flash, but they're not, you know, it's tolerable enough, but you never hear those things. So consider
Right.
the source. And when you do your research, your
Exactly.
Google search is not research. What
Right.
pops up at the top of a
No.
Google search is the stuff that people pay to get to the top of the
Right.
Google search.
Right.
Yeah.
And so you have to be really careful about where you source good information. And I think that that's something, you know, especially for young women who are thinking about fertility and all, you know, you want to be around for your child, but can we protect my ovaries? Asking those questions. I think there should be a Q&A sheet just on this topic for young women. I think that,
Oh,
you know,
yeah. Yeah.
yeah.
We're gonna put something on Love of My Girls
You
about
should do that.
fertility because
Mhm.
it needs to be a conversation just to
Yeah.
prepare, you know,
Yeah.
and we don't want to scare anyone. We just want to give options, you know.
Yeah.
So you do on your Tata Tuesdays, Rhonda, you know.
Right. Dr. Mo, I actually do transparent reviews of my medications. And people are always so, because I don't really have a lot of side effects other than I'm hot, but I don't have. So I will say, like, this is how it made me feel. And then I'll have people say, well, you know, it really took me out. I'm like, really? That happened to you? Everyone's response is so different. But I do transparency because I really need women to take their. So if it's doing me okay, I need you to know that.
Right.
Yeah.
Right.
With D is negative.
Yeah. Please
Listen, tag us in so we can share it.
Yeah.
I would love to
Yeah.
talk about it on our social media.
Yeah. We talked to you about Belong, right?
What? Say it again.
Belong.
Yes. Yes, you did.
Yeah. Oh, join our Belong Facebook group for anyone who's leading a support group or leading a org, you know, join our Belong, you know, email me, we'll send you the stuff. And I think we have our first session on Sunday with Wendy.
Okay. I'll check
Oh,
in.
I get
Talk
in there.
about mental health.
Okay.
Yeah.
Wow.
So thank you guys. This has been so great, you know,
Yeah.
and we thank our friends at the company that makes Olodex who want to get the information out and are, you know, and kind of asked us to help them reach Black women. So here we are.
Yes.
Trying to educate you and give you credible information from two people who've experienced this and we hope that, you know, that's your line, girl. We hope that
We hope it's relatable, reliable, and real. That's what we do every Wednesday night. I have to think about it. Here on blackdoctor.org. Every single Wednesday at 6 p.m. Eastern time, we're on here bringing you the stuff that you need to know, the good, the bad, the ugly, the stuff we don't know, and hopefully empower people to live better lives. So we're grateful to the sponsors, to our guests, our amazing guests. Tell people how they can follow you really quickly on social media.
Yeah. Come to your Tata Tuesdays.
Mhm.
Instagram page is Tata Tuesdays, TATA Tuesdays. And I am Rhonda Brunson on Facebook. So reach out.
Great. I'm
Awesome.
putting that in the comments on Facebook.
Mhm. Yeah. And Dr. Alexia?
And I'm at Dr. Alexia everywhere. DRALEXEA. Facebook, Instagram, Twitter, or whatever it used to be. And my website is dralexia.com as well.
TataTuesdays.com. Home of the breast friends.
I love it.
Love it.
That's it. Bless you, love.
Bless you, love. Bless you, love. Thanks, you guys. Love you, Mo.
See you later,
Love
breast.
See you next week. Love you
Bye.
guys. Bye.
Thank you, ladies. Good night.
Good night. Bye.